Good morning. Well, I'm very happy. It's nice also to do some media events which are medically related, because that's my other part of my life, so I'm very happy to be here.
What do you say about Midday Critical Care Hospital survey of
So this is the first time I've come to this event, and Midday is now going to be, giving a ranking to critical care hospitals all over Mumbai, and I think that's very important. Critical care is a very important aspect of health. It basically involves your ICUs. It involves a very critical part of health, and I think it's very nice to give this ranking so that at least patients get to know which hospitals they can actually go to in times of crisis and emergency as well.
So today there are many doctors and hospitals who have been felicitated by Midday.
Yeah.
आप क्या बोलना चाहते हैं?
मैं बहुत खुश होती हूँ. डॉक्टर लोग बहुत मेहनत करते हैं, बहुत उनको रिवॉर्ड्स और फेलिसिटेशन दिया जाना चाहिए. उनको कभी भी काफ़ी नहीं मिलता. I think the selflessness and the love that doctors have for their patients is something that doesn't get rewarded as much. So whenever such platforms do appreciate the doctors, the hospitals, all the management, I think it gives them a lot of encouragement, because they work 18 hours, and sometimes they're not even paid as much as certain other professionals are, but they've given so much of their years to studying, so much of their years to patient care. It's really important that we value them. It's very important that we give them that platform as well to feel loved, appreciated and encouraged. So I'm very happy that my dear friend Rahul has set up this wonderful thing with Midday, and I'm always going to be supporting the hospitals and always going to be supporting Midday. So I wish them all the best and good luck. Thank you. आपके लिए अलग हूँ.
Hi, good morning. Being in this event where it is all about hospitals and doctors and about medical care, I am perfectly fine.
So today Midday is one of felicitating 15 plus hospitals. So what do you say?
I think it's a very brilliant concept, because we always forget that hospital is one such place where we never want to go, we fear, but that is also one place that saves us. That is one place that is our solace for a lot of our injuries or any kind of fear or any kind of health related things, because that is the solace, that is a blessing in disguise that is given to us and created by mankind. And now that we are getting this platform to honor them, for their facilities, for their services, I think it's a very nice concept, and I really support it in a very big way. मुझे लगता है कि अगर आपके मेडिकल प्रॉब्लम है, आपको एड्रेस करना ही चाहिए. आप अपना धन दौलत या व्हाट काइंड ऑफ मनी, व्हाट काइंड ऑफ फेम, एवरीथिंग जस्ट कीप इट असाइड. बट लेट मी टेल यू, द बिगेस्ट wealth that we can accumulate is good health. And honestly, let me tell you, my grandmother was 95 when she passed away without getting into any sort of hospital or any kind of medical issues, only because she believed and that health is very important. She took care of herself and she had a beautiful life that way. So मुझे बहुत सारी औरतों को, जिनको भी जो भी थोड़ा सा केयरलेस हैं या केयर फ्री हैं अपनी हेल्थ को लेकर, प्लीज़ मत रहिए, बिकॉज़ आपके हेल्थ पर ध्यान देना बहुत ज़रूरी है. और हॉस्पिटल्स, यस, हम बहुत फेयर करते हैं बिकॉज ऑफ कि हम नहीं जाएं, मगर फिर भी वो एक ऐसी जगह है जहां आपको क्योर मिलता है, जहां आपको हर तरीके की फैसिलिटी मिलती है आपके हेल्थ को और बेहतर बनाने के लिए. सो प्लीज़ जाइए. अगर इतनी सी भी दिक्कत है, please address it right now. Thank you so much. Thank you.
Hello ma'am, good afternoon.
Good afternoon.
Welcome to Midday Critical Hospital Survey Award.
Thank you.
So what are your thoughts on this great, beautiful initiative by Midday?
First of all, I would like to thank Midday for inviting me and honoring me with the award, which is Fitness Icon Award. And at the same time, more than that, I would like to give a big thank that with all the senior doctors, I'm sitting and gaining my knowledge, and it is very important, the right awareness which I am listening right now. And as I say, half knowledge is also very dangerous. So what I observe in the society, that they have about the fitness, they have very half knowledge. They think that if they don't eat, they'll become slim and beautiful and all that. But it is not. The right awareness is very important, and I'm very grateful that I'm here today, and it's the very big initiative.
Today Midday is going to felicitate more than 50 plus hospitals. So आप उनके लिए क्या कहेंगे?
Congratulations, Midday, and it is, as I said, it's a very big initiative, and I would like to give big congratulations to everybody.
What are you going to say to the audience जो आजकल जल्दी hospital जाने से डरते हैं, on the remote areas, क्या message देंगे?
मैं उनको यही मैसेज देना चाहूँगी कि बहुत ज़रूरी है सही टाइम पर आपको पता हो कि इन केस कोई डिज़ीज़ है, कोई कुछ बीमारी है, कुछ प्रॉब्लम है, तो आप लोगों के लिए बहुत ज़रूरी है कि आप राइट टाइम पे जाएं. हॉस्पिटल जाने से डरने की कोई ज़रूरत नहीं है. मैं भी हर साल एक अपना सारे टेस्ट करवाती हूँ, फुल बॉडी टेस्ट, विच इज़ वेरी इंपॉर्टेंट, कि अगर इन केस कुछ है तो वो पहले टाइम पे पता लग जाए और हमें उसका राइट ट्रीटमेंट मिल पाए. सो प्लीज़ जाइए, और एवरी ईयर सारे टेस्ट, फुल बॉडी टेस्ट होने बहुत ज़रूरी है. It's done.
So ma'am, आप मार्शल आर्ट रह चुकी है, फिटनेस आप एक फिटनेस फ्रीक भी है,
जी.
and तो आप इसके लिए क्या बोलना?
Yes, I believe in healthy lifestyle. Fitness is very, very important. Exterior, interior, your external body should look nice, and at the same time your interior body, which is your inside, you have to keep yourself very, very healthy. Yes, I do a lot of fitness activities like kickboxing and martial arts and gymnastics and my dance, and at the same time I try to keep my mind also calm and composed, because this is very important. You cannot neglect your mind. So overall, top to bottom fitness is very, very important. Thank you so much.
Very good afternoon. Thank you.
What you will say for this great initiative by Midday?
Yeah, it's a great initiative by the media and Midday. And if you can increase the awareness about the preventive aspect of various diseases, it will help the mankind and the society at large. It will also reduce the cost of healthcare, and for patients it will become more affordable. So this kind of initiatives are welcome, and it should be more in public domain. Thank you.
What is the question?
Hello sir, good afternoon. Welcome to Midday Critical Care Survey Hospital Awards. आप इस initiative के बारे में क्या बोलना चाहेंगे?
Thank you very much. I represent the Asian Cancer Institute. I'm very happy with this overall experience. The way the entire exercise has been conducted, I'm very happy. It is truly a recognition of the work which the entire team does in our field. And I think Midday is a leader in that. It's a very well patronized newspaper, and such recognition actually gives us more encouragement to continue our work and probably improve it further. Message is very simple: live well, live healthy, avoid bad habits, do a little exercise, sleep well, minimize your stress. You can't eliminate stress, but minimize your stress. Have regular health checkups and treat them immediately. Have a checklist and identify where exactly will you be treated if at all you are sick. And never forget your health insurance. Thank you.
Yeah, you want me to say something?
Yes. Just one or two questions.
Yeah.
The Midday Critical Care Hospital Survey. What do you think about this initiative?
I think it's one of the most required initiatives because health is very close to our hearts, and health of women particularly, because there are so many challenges that women face these days, and these challenges are 50% mainly concerning their health issues. It may be their day-to-day lives, the anemia in their lives, or it may be the stressful living of modern world. So I think that we need to take more care of women at home, whether they are of any age group, and that is what is required today.
And there are many hospitals there who are going to felicitate today. Then what messages are you going to say?
So this is the hospital survey, right? You're doing the survey of hospitals. So what exactly is going to happen in the survey?
There are big hospitals, those who are getting felicitated here.
Okay.
What do you say?
Yeah, I think that appreciation of doctors in today's world and the hospital is very needed because they are the backbone of the society, and hospitals with good doctors is the requirement of the day, because we find that there are doctors, there are graduates coming out every day, but how much concern they have for the patients and how much they feel for them, because it's a patient is not just one particular body, but it's a holistic person who needs to be dealt with.
How are you guys? Hello ma'am, welcome to Midday Critical Care Hospital Survey Awards. What do you feel about this initiative?
So I think it's very, very important for the country to know the real benefits and the programs going around in the country regarding healthcare, regarding mental health, regarding physical health. Everything is very, very important, and I think thanks and kudos to Midday that they organized such an awareness-based event. And it was great listening to all the top doctors of the country and the life that they have dedicated to save lives and to be there for us. So I think it's a it's an honor to be here and to hear the cream of the country talk about the medical industry.
So मैम आप जितने हमारे वुमेन्स हैं और या जितने लोग हैं जो कहीं ना कहीं थोड़ा सा डरते हैं हॉस्पिटल जाने से अपना रेगुलर चेकअप कराने से बहुत पीछे रहते हैं उनको लगता है अगर हम चेकअप कराने गए तो कुछ अगर निकल गया तो फिर हम कैसे उसको सर्वाइव करेंगे कैसे हम उससे डील करेंगे तो आप उनसे क्या कहना चाहते हैं?
See, I think सबसे important saying है डर के आगे जीत है. So we should definitely get things done, like how recently the cervical cancer thing was going on. Like now I think the country is aware regarding the vaccination of it, and women should get, and even I think men face some problems sometimes, the papilloma virus or something. So I'm just only hoping that people go ahead and get more regular tests done, because you never know what is underlying, what are the dormant diseases that you carry, and it is always better to diagnose it before it's too late. So like you say, prevention is better than cure. So one should go past that fear of needles, injections and tests, and definitely get their checkups done.
आज काफ़ी हॉस्पिटल्स को ग्रेटिफाई किया है मोटिवेशन मिली है एक आज इस मुद्दे के थ्रू आप उनसे क्या
Well, I think doctors don't need any sort of, awards or something, because they are the heroes without capes. And for me, every single day is like a doctor day, because anytime, any place you're going through something, you'll always remember a doctor. And doctors should be honored every single day. And according to me, how I was saved during COVID by doctors, I value doctors a lot. Also coming from a family of doctors, I think doctors are like the top-notch cream of this country. Thank you so much. Thank you.
Sir, camera.
A very good afternoon. A very good afternoon, and welcome to Midday Critical Care Hospital Survey Awards. आप इस initiative के बारे में क्या कहना चाहेंगे?
This is a very incredible initiative. I think people need to be aware of what's happening in critical care treatments, what are the latest trends, and I think Midday has really is doing a good job by creating awareness.
And what about the audiences? आप audience से क्या कहेंगे? कैसे अपने आप को fit रखना है? कैसे खुद की help करनी है? Because nowadays अभी काफ़ी एक जैसे अभी cervical cancer की बात है, cervical cancer के बारे में पता चला, knowledge हुआ, because काफ़ी ladies को पता नहीं होता है, but through one negative thing एक अच्छी चीज़ बाहर आई है, आप उसके लिए क्या कहना चाहेंगे?
So I think regular checkups are extremely important. One, awareness regarding own body. Whether you are trained in medicine, not trained in medicine, basic knowledge about one's biology is critical, and I think that's a very important factor. Second is lifestyle. I can't stress it more. I mean, it's such a overused term, but lifestyle change and having a healthy lifestyle, I think that's critical to having a good health.
I think this whole initiative is a fantastic thing that Midday has done. I think increasing awareness is a continuous process. It needs to happen. It needs to happen continuously over a period of time. From what you said, I think this whole India doesn't have this mentality yet of doing an annual health checkup, and the criticality of it can't be understood enough. So that is something that we as a society need to imbibe, especially people over 40. That's in Western countries it's a given that you have to do an annual health checkup. It's just one easy way of just keeping ahead of maintaining good health. People take it far too lightly in India, but that's something that we should kind of imbibe as a natural thing to do.
मिडडे के लिए आप क्या कहना
Keep up the good work. Fantastic. We are very, very impressed with whatever initiatives you have taken, the way you have executed it, and hands off to you.
Thank you.
Thank you.
Yeah. This is very unique initiative that Midday has taken, and I would like to appreciate Midday and thank Midday to identify Solaris Hospital as a unique non-corporate hospital in central suburb as a best neurology services. So I would say that this is not just about the big corporate hospitals which are there in the Thane and Mumbai, but also the small hospitals and which are serving the patient has been identified. The Solaris Hospital has been the only non-corporate hospital in center Thane and Mumbai to provide the services of neuro navigation, that is computer guided brain surgeries for the patients at affordable costs.
and what advice, what sort of advice you can give to our audiences?
So I would like to tell the audiences that the treatment facilities are there at affordable prices at your doorsteps. Not just the big hospitals, but you can always go and search around here. Just you have to be vigilant for your treatment and identify your diseases. Thank you.
Good.
Very good afternoon, sir, and welcome to Midday Critical Care Hospital Survey Awards. How do you feel about this initiative took by Midday?
Yeah, the team is really excited hearing this, and the combination which has happened today morning, the survey is already released, and we are going to get the certificate today, and the team, the entire staff, the consultants, everyone is excited.
What sort of advice you give to our audiences, which कहीं ना कहीं थोड़ा सा डरते हैं वो हॉस्पिटल्स जाने के लिए, उनका केयर करते हैं बट हॉस्पिटल्स जाके रेगुलर चेकअप्स नहीं करवाते, इसके लिए थोड़ा सा वो लोग पीछे रहते हैं, आप उनसे क्या बोलते हैं?
उसमें अभी I would say awareness is coming up more. प्लस सेक्शन 80D के मुताबिक गवर्नमेंट ने भी एक टैक्स एग्जेम्पशन किया है, तो हेल्थ चेक्स का पेनिट्रेशन इज एक्चुअली कमिंग मोर, एंड यू कैन एक्चुअली सी द ट्रेंड ड्यूरिंग फेब एंड मार्च, कि 31 मार्च तक ही वो एग्जेम्पशन ले सकते हैं. यस, हम लोग भी काफ़ी कॉर्पोरेट्स में हेल्थ चेक अवेयरनेस इंट्रैक्शंस रखते हैं, देन उसमें भी स्टाफ मोटिवेट होके दे कमिंग इन. Okay, any taxpayer under Section 80D, they can claim a tax exemption up to 5,000 rupees every year. That is over and above what the normal tax, it's on health checks, if you do that. Pleasure.
Thank you.
Very good afternoon, sir.
Good afternoon.
Welcome to Midday Critical Care Hospital Survey Awards.
Thank
So
you.
first of all, congratulations for the award.
Thank you very much.
So, what you will say about this initiative took by Midday?
Oh, I think it's a very good initiative that Midday has taken. It's an initiative which will benefit not only Mumbai, but I think it will be splashed across Maharashtra and most probably all over India. So therefore, there will be a lot of people who will actually benefit enormously by such a program. It's a very bold and a very powerful initiative, and I'm very happy that Midday has taken the step forward to do this. Thank you.
Sir, what advice will be you will give to the audiences for to keep them fit, to keep them every now and then to get them tested or to get the body checkup? So, क्या?
Hindi or English? Sorry?
Anything, English.
The best remedy for fitness starts at the kitchen. If you have a kitchen which is very well controlled
and your food is very well controlled, you will definitely be very healthy. Now, apart from the kitchen, there is also physical activity. And physical activity does not mean that you have to run 5-6 kilometers. It means walking where you can do it. Climbing upstairs, not downstairs, is a good idea. And at the same time, if you can avoid taking a transport, then it is much better to walk rather than just take a transport and go somewhere. Also, I would like to emphasize the fact that there are so many things within our culture. For example, meditation, yoga are things which are generally ignored by people, but if you do that, you will definitely lead a healthy life. Today, we are visited by a lot of metabolic disorders, and diabetes being the most important of them all. It is insidious, it does not show very many symptoms, but it can harm your body. So you should go to an organization where they have this care for diabetes in a holistic manner. And in my hospital, Dr. L.H. Hiranandani Hospital, we have the Hira Regain program, that is Hira for Hiranandani, which is also a diamond, and you regain your health. So you will lead a sparkling life, and you will be healthy, and you will be very well in your longevity of life. Thank you very much. Thank you.
Well, congratulations, ma'am, for the awards.
Thank you.
क्या बोलना चाहेंगे?
It really means a lot to me, Fitness Icon Award. As I said, fitness is very important, and they considered me as a fitness icon. So thank you so much, Midday, for giving me this award. Thank you.
Good afternoon, sir, and congratulations for this award. So, what are your blessings and what are your advice for the audiences for their fitness, to keep them fitness?
I think the doctors on the panel gave fantastic advice. Follow it.
Thank you. And what you will say about this great initiative took by Midday?
I think it's a good initiative. It gets people the right advice. They know where to go, what not to do. Right? Thank you so much.